Welcome to Summer in the City. The Philadelphia Department of Public Health made this webinar to share heat safety tips and information about city services to help you stay healthy throughout the summer. Summers in Philadelphia have always been hot and humid, and they are getting even hotter because of climate change. This means that Philadelphians will see more very hot days per year than we are used to, and we need to be prepared for how that may affect our health. Philadelphia is especially sensitive to extreme heat because cities are hotter than suburban areas. This is because cities have a lot of dark surfaces, like roads and rooftops, that absorb heat. Cities also have fewer trees and green space, which can keep things cool. Hot weather can harm your health when there are multiple unusually hot days in a row. This is especially dangerous when temperatures do not go down at night, because you do not get a break from the heat. Very hot weather like this can make you sick. The health effects of extreme heat include dehydration, heat rash, sunburn, muscle cramps, heat exhaustion, heat stroke, and even death. It is important to know the signs of heat stroke because heat stroke is a medical emergency. Heat stroke happens when your body temperature reaches 103 degrees or higher. Symptoms include hot, dry skin, headache, dizziness, nausea, confusion, and passing out. If you or someone around you is having heat stroke, call 911. After calling 911, try to lower the body temperature by placing cool water or cloths on the skin, and then move the person to a cool place. Do not give this person anything to drink. Some people are more likely to get these heat-related illnesses than other people. This includes people age 65 and older, infants and young children, pregnant women, people who work outside, people who live alone, people without access to air conditioning, people who are experiencing homelessness, athletes, and people with some chronic medical conditions. If you have diabetes, heart disease, kidney disease, respiratory disease, or a mental health condition, extreme heat may be especially dangerous. These conditions can make you less likely to sense and respond to changes in temperature. Also, some medications like beta blockers and water pills can make the effects of extreme heat worse. If you have any of these conditions or take medications, talk to your doctor to learn more. There are things you can do to stay safe and healthy during extreme heat. First, you should stay informed of local weather conditions and know which are most harmful to your health. Multiple days of high temperatures are the most dangerous. Stay cool by avoiding direct sunlight and limiting your time outside during the hottest parts of the day. However, make sure that if you are staying inside, that you have access to air conditioning or a fan. If you only have access to a fan, make sure that you open a window to let in fresh air and that your fan is installed correctly. You can also wear light, loose-fitting clothing or take a cool shower or bath if you are feeling very hot in your home. It is also important to stay hydrated. This means drinking plenty of water and avoiding drinks that can dehydrate you, like alcohol, caffeine, and sugary drinks. If you have a family member, friend, or neighbor who is older or homebound, check on them during heat waves. Make sure they are drinking enough water and that they know how to keep cool. Check for any signs of heat stress and let them know that it is okay to ask for help. Call 911 if you think they are having a medical emergency, like heat stroke. The City of Philadelphia uses a warning system to let people know when they should be concerned for their health during extreme heat events. We call this a heat health emergency. When a heat health emergency is declared, some city services are activated, including the PCA heat line and cooling centers. The PCA heat line is a call center where you can get heat safety tips. If needed, health department nurses can speak with you about any medical issues you are having because of the heat. If you have a serious medical problem, call 911. Write down the Heatline phone number and keep it in multiple places in case you or another person is having a medical problem due to heat. The Heatline does not give out free AC units or fans. Cooling centers are air-conditioned spaces that stay open later during a heat health emergency for public use. Your local library branch or recreation center may be a cooling center. If you can't get to a cooling center, visit another public space with air conditioning, like your local senior center or shopping mall. Even a short amount of time in air conditioning during the hottest part of the day can help your body recover. The city also operates public swimming pools and spray grounds to help you keep cool during the day. During a heat health emergency, call 311 to find a cooling center near you. If you would like to learn more about how to stay healthy during extreme heat, you can visit these web pages. To stay in the loop on public health and emergency preparedness information, trainings, and upcoming events, sign up for our Health Bulletin listserv by clicking on this link. Thanks for listening to our webinar today, and stay cool this summer.